Hey guys, it's Leah and you're watching Mommy in the Moment. If it's your first time joining us, welcome. If you are not new here, then welcome back. So today I'm going to do a kind of second, third trimester update on my pregnancy. I'll talk about what kind of symptoms I'm having, how things are going medically speaking, and then what we're doing in order to get ready for this baby. So I am 31 weeks today. Yay! So 3 weeks into the third trimester, and things are going well so far. I think the new symptoms that I've been having have been, one, my fatigue has gotten better. I mean, I'm still tired, and it's very unpredictable when I'll be like massively tired, but the fatigue has improved a lot since the first trimester. I'm having more instability in my hips. So my SI joints, the joints kind of right at the back of your hip bone, kind of low down around your sacrum, those kind of pop, they crack like your back is cracking. And sometimes it hurts whenever I stand up. So that's not unexpected, but it's happened later this time than it did with any of my other pregnancies. So I'm grateful for that. My snoring has begun again, but I feel like I'm managing it better this time. If you haven't seen my video on embarrassing pregnancy symptoms and hacks to improve them, then definitely go and watch that because I tell you exactly how I'm attacking the snoring, but it's gotten a lot better. I sweat at night, which is fun. And super fantastic. I'm sure Chris is a super fan of that. But I will do a video on how I am managing comfortable sleep in the third trimester. I have not gotten any new stretch marks. All of my stretch marks have been kind of like right in the middle, right above my belly button, because my abs spread. And so that's where my skin gets stretched the most. I haven't seen any new ones. The old ones are very stretched out and very apparent. But yeah, I haven't seen any new ones yet. Let's see, not doing a whole lot of swelling in my feet yet, but if I do eat too much salt, my hands will swell, my face will swell, so I have to be careful with that. Oh, I've been having more like contractions here and there. So not the painful contractions that kind of stop you in your tracks, but where my belly will get tight and hard and then it'll relax. And that'll happen 1 or 2 times a day. That's completely normal if you're dehydrated, if your bladder is full, or just if the baby is moving and growing. It doesn't necessarily mean that you're in labor. So that's been happening a little bit. And baby's movement has just been like on 10. I can tell whenever he's head down versus breech, because I can feel where his movements are, but I think he's been mostly head down from here on. And I feel a lot of kicks up high in my belly. So that's been really fun and really exciting and nice to experience. All right, so on the medical side of things, medically, things are also going well. Nothing is untoward. I have something called a marginal cord insertion to my placenta. And so instead of the cord going right into the middle of the placenta, it attaches to the edge. So every now and then with that, babies can have growth issues. So I've had a couple of growth scans. My last one was about a week ago and he was growing just fine. My fluid was fine. So very happy and grateful for that. Now, my only medical issue currently is that between my last appointment and then my most recent one, I gained 10 pounds. And my doctor looked at me very, very frankly and said, "You've gained too much weight in a short amount of time." So that was discouraging, but like I said in my pregnancy fitness video, a fit pregnancy is not a skinny pregnancy, but we also want to make sure that we're moderating our weight gain. So I have a plan for that, but I'm going to make a video on that and you guys can check that out later. Scheming. So overall, medically, things are going great and I'm not having any major issues. All right, so what are we doing to prepare for this baby? So if anybody knows me, I am a list maker, okay? I make lists upon lists. I make lists about the lists I need to make, okay? Okay, so I have some lists in my phone, I have some in my little notebook, but I'm making lists and plans for what I need for myself for postpartum and breastfeeding. I do not want to be figuring that out once I get home with a new baby, right? How we need to set up our house logistically for baby's kind of bassinet area when he's in our room, and then changing stations when we're downstairs, because I don't want to have to come upstairs to make a special trip just to change the baby. Getting his nursery set up, obviously, and getting all his clothes put away and things like that, and then planning my kind of laboring and hospital bag. I'm planning to hopefully labor as much as I can at home if everything goes well. And then I'm gonna make a list for my hospital bag, so I'll need stuff for myself, for Chris, and for the baby. And I want to make sure I don't miss anything. I'll definitely be making a video about planning my hospital bag, especially since I'll be delivering at the hospital where I work. So I'm intimately acquainted with the practices and the people and how things go before, during, and after labor. So I'll make sure that I put that video up as well. We are also getting the kids ready to have a sibling, and we're trying to make sure that they're mentally prepared and emotionally prepared to have a new baby coming home. Also, conveniently, our car, one of our cars, is not working so well. So we're in the market for a new car, and we are trying to get that situated before the baby comes as well. So lots going on, lots that I'm getting ready for. Oh, this is one of my little notebooks, my lists of lists. So you can see I'm kind of starting to put down what it is that we need for different things so that I don't forget things. Because pregnancy brain is real. I'm not going to remember in the last minute. I'm not going to know what it is that I need if I'm in pain and contracting. Like, we just need to have all the stuff laid out. So it seems like 31 weeks might be too early to be prepping for this, but I don't have that much longer. So if you would like to see any of these videos about sleeping comfortably in the third trimester, about getting ready for your hospital stay and labor, and then also preparing for the postpartum, kind of returning home, definitely stop now and subscribe to the channel, because those videos are coming. And I would love for you to be able to share that with me. I'd love to be able to share that with you. If you're pregnant in your second or third trimester, drop a comment below. What things have you been getting ready for? What things have you been experiencing? Thankfully, this has been going well so far, and prayerfully it'll continue to be that way. You guys, thanks for joining me, and we will see you in the next video. All right, bye.